name's Emily Millard, and this is a presentation talking through the spine and explaining through some basic spinal anatomy. The spine is a structure made up of 33 bones altogether, and 24 of these are movable and 9 of these are fused together. The movable bones articulate together and allow for movement, and they include the 7 cervical, 12 thoracic and 5 lumbar. The fused bones don't allow for movement, and they are made up of 5 sacral and 4 coccyx. The movable bones make up the superior portion of the spine, while the fused bones make up the inferior portion of the spine. The 5 regions of the spine work together and cover specific areas of the vertebral column. So the cervical region covers the neck area, and this is made up of bones C1 to C7. The thoracic area covers the chest, and this is made up of bones T1 to T12. The lumbar region covers the lower back, and this is made up of bones L1 to L5. The sacral area covers the pelvis area, and this is made up of bones S1 to S5. And then finally the coccyx area covers the tailbone, and this is made up of bones CO1 to CO4. The spinal cord runs down the middle of the spine, and the nerves are attached to the spinal cord and exit out of the spine on both the left and the right sides. They act as electrical wires that supply the muscles and organs with the energy and the nutrients that they need. The nerves in the neck supply the arms and the brain. The nerves in the mid-back supply the torso, and then the nerves in the lower back supply the abdominal area and the legs. The vertebral column has 4 main functions. Firstly, it provides support and stability in the erect position, providing a specific base for the head and the trunk. Secondly, it assists with movement and locomotion by permitting movement of the head and trunk and allowing for flexibility and mobility, and this permits movements such as flexion, extension, twisting and bending. Also, the vertebral column provides support for the spinal cord, nerve roots and other internal organs, and this protection allows for structural integrity to be maintained and also for these specific parts of the body to maintain their functioning. And then finally, the spine provides a site for muscular attachment. Without the spine, the body would be able to stay upright or connect different parts of the skeleton to each other. For instance, the arms and the legs, the chest and the shoulders, all to attach and make one full skeleton. When viewed from the side, there are 4 natural curves in a healthy adult spine. The cervical and the lumbar region curve inwards, and then the thoracic and the sacral regions curve outwards, and this S-shaped curvature is what makes the spine stable. It helps maintain balance in the upright position and acts as a shock absorber when the person walks, and this protects them from injuries such as fractures. Each of the individual vertebrae of the spine are connected anteriorly by intervertebral discs and posteriorly by facet joints, and there's an intervertebral disc between every vertebra with the exception of between C1 and C2, which will be discussed a bit later on in the presentation. The intervertebral disc is a layer of cartilage that allows for movement between adjacent bodies. It provides for shock absorption and transmits loads through the vertebral column. They form a cushion-like structure that protects the spine and prevents them from rubbing together and causing friction. Each disc has a tough outer layer called the annulus and a gel-like inner layer called the nucleus, and both of these parts of the disc have their own important individual functions that are actually opposite each other that ensure the right support and allow for the right movements of the spine. The nucleus plays a major role in providing the spine with its shock absorption properties during movement. It transmits changes during compression forces, and it prevents the bone-to-bone contact, which reduces the possibilities of a person being in pain and then this leading to injuries. And it disperses the load and the forces dispersed or placed on one area across the whole vertebral column due to its high water content, which is very important in it being able to maintain its function. The annulus has crisscross fibres that hold the vertebral bodies together, and it enhances the rotational stability, which helps it to resist its compressive forces and resist forces such as torsion, flexion and extension that are put on the spine. The annulus is a ring shape of ligament fibres that enhances the inner part and securely connects it to the vertebra above and below. Discs also have a third important component, that is the cartilaginous bony end plates, that are thin layers of hyaline cartilage that bind the disc inferiorly and superiorly to adjacent end plates. Their main function is to act as an interface between the dense, harder shell of other vertebrae, and they keep the nucleus pressurised and prevent them then from bulging into the soft, spongy centre. The end plates have the unique role of acting as the main transport for nutrients in and out of the cell, and being able to keep the cells alive by providing them with the nutrients that they need, and also to stop them from degenerating. The facet joints are another important feature of the spine, and they act as connections between the bones. The nerve roots pass through the joints to go to and from the spinal cord to the arms, the legs, and other body parts. These joints allow the spine to bend, twist, and keep the back from slipping too far forward or from twisting without any form of limit or control. Facet joints are symmetrical synovial lined joints with a fibrous capsule that connect articular facets of the joint. The superior facet of the lower vertebra articulates them with the inferior facet of the vertebra above it. The facet joints are situated between the pedicle and the lamina of the same vertebra and form the articular pillars that act to provide structural stability to the spine. Moving on to discuss a little bit more of specific spinal anatomy, which overall moving down the spine is very similar with the exception of C1 and C2. C1 and C2 have a slightly different shape compared to the rest of the spine. They're the first two vertebrae, and they are found at the top of the spinal column, just part of the cervical region. C1 is also known as the atlas, and C2 is also known as the axis. C1 is slightly ring-shaped and is located just below the occiput of the skull. This allows us to move our heads up and down. And then C2 has a protection coming out of it known as the dens, and this allows for moving the head right and left in rotation. The rest of the vertebral segments of the spine have a very similar structure. Firstly, the body of the spine, or the vertebra, is the weight-bearing portion of each vertebra and allows you, and as you weigh down the spine from the cervical all the way down, they actually get bigger, and this is because they need to support more weight as they progress down the spine. And then there's an intervertebral disc located between each of these bodies. The vertebral foramen is where the spinal cord travels through, and then there are two pedicles on each side of the structure. This connects the body to the transverse process. Each vertebra has two transverse processes that come off the body and extend posteriorly and laterally. The transverse process of the thoracic spine articulates with the ribs. The lamina connects the transverse process with the spinous process, and each vertebra has a spinous process located on the posterior aspect of it. Finally, each vertebra needs to be able to articulate with the vertebra above it and below it, and to do so, this requires each vertebra to have an articular process. Firstly, the superior articular process is located then in the superior portion of the vertebra and allows it to articulate with that of the vertebra above it. The inferior articular process is located in the inferior portion of the vertebra and allows the vertebra to articulate with the other vertebra below it. The anterior articular process articulates with the articular process of that above it, and vice versa with the other way around. Within the cervical spine, the vertebrae have a special feature, and this is called the transverse foramen, that allow the vertebral veins, the vertebral arteries, and the sympathetic nerves to pass through it and have access up to the skull and the brain. Except for C1 and C2, as well as the sacrum and the coccyx, all vertebrae are made up of vertebral body at the front and a spinous process which is towards the back. Both parts are connected by the vertebral arch, which forms the cavity in the middle. These cavities align to form the spinal canal, which surround the spinal cord and is down the whole middle of the spine. The vertebral arches have a slight recess at the top and the bottom of each edge at the point where two vertebrae come together and they meet. One of these is located on the right and the left sides. The spinal nerves exit the spinal canal through these gaps, and because the spinal nerves branch off as they go down the spine, the spinal cord also starts to thin out as you progress down the spine. The spinal nerves carry electrical signals from the brain to the muscles around the skeleton and also to internal organs. Similarly, they also carry sensory information like touch, pressure, cold, warmth and pain from the skin, the muscles, the joints and other internal organs to the brain via the spinal cord. Together, the brain and the spinal cord work together to form the central nervous system. Overall, there are many demands placed on the spine, and understanding the spine and how it works can help to better understand the problems that occur in things such as injury and aging, and also can help to better protect and treat patients with problems with their spine.